Now, one of the things that I think their listeners need to understand is that not every patient that comes through your doors is an elderly person that just has a degenerative issue with their heart. That you may have a fairly young person that's coming.
Right, and in fact, those are the toughest ones sometimes to try to program a pacemaker to, because the elderly person has much less variation in heart rates that they require. For example, they might need a resting heart rate of 60 to 70, and their maximum effort heart rate may be 110 to 120. If you take a young person, they might require a heart rate between 60 and 200, with activity, and that would be their norm. So it's much more difficult to tailor that patient than it is the elderly patient.
And that's part of what you do. I mean, you can change settings within
and
the
as
pacemaker.
you know, some of the most challenging cases are the ones that want to exercise, the ones that want to keep doing what they're doing.
Is it safe to exercise with
absolutely?
I mean, everybody's different, but I mean, in general,
it should be very safe to exercise with pacemakers, and any kind of activity really is safe.
Now, I'm finding people who have pacemakers that are exercising are getting close to what I would almost think if they didn't have a pacemaker, they're achieving results that are very similar. I mean, it's quite amazing.
We're able to restore them back to where they would be if they had a normal cardiac conduction.
So their quality of life is really
should be what it was before, with the caveat that they need some maintenance for the pacemakers. They're not maintenance-free devices. We need to check them so often. The weak link there is the wires that go from the pacemaker pocket or the device itself to stimulate the heart.
Right.
And that's being addressed with the next generation of pacemakers.
Do you think there's ever a time, I mean, cars, things like that are kind of fly by, no wire? In other words, you have a sensor, but you don't have to have a hardwired.
That's coming. Now, the first step to that is we've developed miniaturized devices that actually get implanted directly inside the heart.
Oh.
So we have a pacemaker, and that could be a quarter of a centimeter in length or half a centimeter in length, and can provide 12-year battery for a single chamber pacing. So we've already implanted many of those. They're called leadless pacemakers.
Okay.
So the generator itself and the lead, the whole system is miniaturized into a small body that gets implanted through the vein into the groin and goes into the heart and hooks into the heart muscle and just stays there.
Right.
We're able to interrogate it from the outside and reprogram it. It still has a sensor, surprisingly enough. It's an accelerometer. It's a little piezoelectric crystal. So that is for patients that only require one chamber pacing.
Okay.
But I can't imagine a patient who requires a one chamber pacing now that I would do a conventional pacemaker and not this kind.
Okay.
Because it's less risky.
Right.
It's quick, and frankly, it removes the weakest link, which is the long wire that has to be implanted from the vein that returns blood from the upper extremity to the heart. So all that length, that 58 centimeters of length of that wire, is the weak link, because it has to withstand the motion of the heart. Every heartbeat, it has to pull and move around and torsion, and there's hundreds of thousands of those. So it's like pulling and pulling on those wires, pulling and pushing and turning around.
And they have to be replaced from time to time, is that correct?
And they do have to be replaced because they can't last forever, and that's still the weakest link there. This removes that from the equation totally.
So that just makes it easier on the patient, less times that they have to...
Easier on the patient. You don't even see a scar. You can't tell that they have a pacemaker.
Wow.
It wouldn't even be detected at the airport in a walkthrough. And because the antenna is inside the heart, there's no big antenna to field signals from the outside world, they're actually better protected. There's less likely to have any external interference with those.
Wow.